The objective of this video is to assist you in leveraging the tools found within your iTero digital scanning platform to give your patients the most comprehensive digital dental solutions available. In 2016, just 22% of dental treatment plans presented to patients converted to actual treatment. Our goal is to assist you in maximizing utilization of your iTero digital scanner to increase case acceptance for both restorative and orthodontic applications alike. Let's get started.
Prior to initiating the scan, it is important for the dental hygienist to introduce the patient to the scanner and explain exactly what they are doing. This is also a great opportunity to brand your practice as the digital solution for your patient's dental needs.
In addition to the cleaning, we will also be doing a computerized mold of your teeth, okay? And that way, we can go ahead and get a baseline for the mold of your teeth with our iTero machine, okay? Awesome. It's a 3D scanner. It's brand new technology we have here at Jackson Dental, okay?
Awesome. Sounds good.
So let's go ahead and get started with your x-rays.
Okay.
During a routine hygiene appointment, the dental hygienist will scan the patient prior to the doctor examination. We recommend starting with an attainable number of patients until you perfect the process. First, 2 patients per day, then all new patients, eventually progressing into scanning every patient that comes through hygiene. Work with your Invisalign consultant to help put these processes into place.
So what it's going to do, it's going to take thousands of pictures per second, and it's going to create the mold for us. So what I'm going to do is I'm going to start on the bottom arch, okay? And then we're going to work our way back up to the top. Okay. If you could do me a favor and take a big swallow for me. Try to get your mouth as dry as you can. Excellent.
It is important that the hygiene team become experts in scanning patients for records. The goal for all scans should be 5 minutes or less. With training and practice, this is easily attainable. We recommend collecting a scan on every patient at least once per year.
Okay. And then if you'll go ahead and bite down how you normally bite. Excellent. And then the other side. Perfect. So you can go ahead and bite down. Excellent. So now you can see if I'm going to sit you up slightly. You can slide those off and I'll sit you up. You can take a look at your digital models.
Once the hygiene appointment has concluded, the hygienist should run an occlusogram and discuss any concerns by utilizing the PCS method.
Our iTero scanner, it has many amazing features. This is something we call the occlusogram. Occlusion is the way your teeth come together, so it shows us which sides are hitting harder than others and where you're putting the majority of your wear and tear. So as you can see here, we all kind of know red, we associate red bad, but as you see here, we can kind of zoom in and show you. This is going to be your top arc and this is going to be your bottom. Where the red is where you're putting a lot of wear and tear. So it may be in the evening when you're grinding, clenching, all these different things. The good thing about this is that there are many solutions to fix this, and I'm going to let Dr. Jackson come in and talk to you about what we can do to alleviate some of this heavy wear. Okay?
Awesome, thank you.
You're very welcome.
Prior to the doctor examination, the hygienist should inform the doctor of any potential concerns identified during the hygiene appointment. Should the doctor agree with the hygienist's findings, this should be communicated to the patient using the PCS method. Utilize the occlusogram to allow the patient to visualize their malocclusion or oral trauma. Encourage the patient to manipulate the model to see things for themselves. Then use the outcome simulator to show the patient a rough draft of what their smile could look like after Invisalign clear aligner therapy, which will result in a functional, healthy bite.
Hey,
Hello.
good morning.
This is
How are
Morgan. You remember Morgan?
Yeah, of course. How we doing?
Good.
She's doing wonderful. So today she is
Thank you.
not in any pain, which is great. Hygiene was wonderful. She's doing a great job as far as hygiene goes. There were a few things that I noticed on the occlusogram, so I wanted you to kind of go over some possible solutions for that with her.
Okay.
So
Perfect.
I'll let you get the exam done first. Ms. Morgan, you can go ahead and put those sunglasses on. That way he's going to have a bright light in your eyes. Excellent.
Here we go. How'd Anna treat you? Okay.
Really good.
Yeah.
No
Squeaky clean.
complaints.
All right.
Exactly.
Good.
She's a wonderful patient.
Good.
Should the doctor confirm the hygienist's findings, he or she should communicate that to the patient while utilizing the occlusogram as a visual aid. Once the malocclusion is identified and understood, the doctor should run an outcome simulation to show the patient what their smile could look like after Invisalign treatment. Our data indicates that upwards of 70% of patients that view an outcome simulation accept Invisalign treatment as prescribed.
All right, Morgan. As Anna mentioned, the teeth are not coming together correctly, and I agree with what she's saying there. A lot of people don't know this, but a bad bite can be quite destructive, and a good bite is actually protective. Have you ever noticed these little notches on the backs of your teeth, on the molars? You've got a couple potholes there, and you've got a lot of wear right here at the incisal edge. Have you ever noticed that before?
A little bit on the front, but I haven't noticed the potholes in the back.
Okay, yeah. Part of my job is for us to look, 10, 15, 20 years down the line and make sure not only that you have teeth, but that you have healthy teeth. And the reason why we're having this wear here is because the bite isn't balanced. And when the bite isn't balanced, you're crushing certain teeth and certain parts of the teeth. And that's why you can actually see the dentin or the inner part of the tooth, the yellow portion there, through the already at this point. And that's pretty premature for someone your age, So this is something we really need to think about correcting to avoid, unneeded or unnecessary dental treatment and dental expense. Have you ever heard of Invisalign or any kind of clear aligner therapies before?
Yes, I have.
Yeah. Do you know anybody that's been through it?
I do.
Okay, so you kind of know the process a little bit. Okay, yeah. Well, you would be a great Invisalign candidate. We've treated tons of cases just like yours, bites like yours, just like this, and we've had absolutely amazing results. And I think you would have absolutely amazing results. Let me show you a simulation of what your teeth could look like if we did put them in the right position and take them out of trauma. It's a pretty cool feature of the iTero, actually. Let's take a peek. It takes a couple seconds to load up, and while it does, the main reason we're having this conversation is because we're concerned about the longevity of your teeth, right? Mm-hmm. And while it's true that teeth that fit together properly last longer and need less dentistry, they also look really nice too, So and it's always nice to have that nice, beautiful smile. We'll be able to see here in a second what it will actually look like. There's a huge preventative component to orthodontics, and that's really the reason why we're talking about this today, is to prevent future wear, future problems, and avoid coming to the dentist as much, So I know you love coming to see me, but let's try to minimize that as much as possible, right? Keep it cleanings only. And kind of get a little sneak peek of what it looks like. All right, so here we go. So on the left here, you can see this is your current smile and how the teeth are positioned. Here on the right side is what we would look like after Invisalign is over, okay? Putting the teeth back where they belong, and what do you think? It is wow, right? It is wow. Yeah. All right. Any questions about any of this? No? I'll send this to you through an email so you can take a peek at it and you can play with it tonight too.
Okay.
But what I'll do next is I'll bring you up to Yaya. Yaya's in charge of, making dreams come true, I call it, right? So, and helping prevent all these future problems. So we'll get together with her in a second and see if she can come up with a plan for us and see if we can get started today, okay?
Awesome. Thank you.
Okay, great.
Same-day case acceptance is critical to success with Invisalign. Treatment acceptance rates drop significantly if a consumer does not commit to treatment on the day of their consultation. When the PCS model is properly utilized, moving forward with treatment is a seamless process.
All right, you follow me up. Hey, Yaya.
Hello, Dr.
This is Morgan.
Hello, Ms. Morgan.
You
Good to
remember?
see you again.
See you too.
We just had a hygiene exam and we did 3D models and we talked about fixing her bite through Invisalign. And I told her you would be the woman to make her dreams come true. So,
I'll take care of you, Miss Morgan.
Awesome.
all right,
Thank
have
you.
a great day. It's nice to see
Thank
you.
you. Nice to see you too.
All right, bye.
Thank you, Dr.
Thanks.
Oh, thanks.
It is important for the practice to offer multiple financial options. Therefore, patients will not be held back by financial reasons for getting the treatment they need. As a treatment coordinator, remember to assure them of your willingness to find a payment plan that best fits their budget.
Well, Miss Morgan, based on everything that you heard today, do you have any questions for me?
I just don't know how I'm going to pay for it.
Valid concern. Well, we would hate for financing to be a reason why you don't move forward with treatment. We have several different payment options, and I'm confident we'll find one that will fit within your budget. Let's review together.
Okay.
Treatment acceptance is an exciting step in the betterment of your patient's oral health. Be sure you and your team celebrate that investment. This not only improves treatment compliance for current patients, it also assists with new patient referrals as well as continued growth of Invisalign within your practice.
We have had a lot of patients come through that start the Invisalign process, and they have all been thrilled about the results. I'm excited for you.
I'm excited too.
Now remember, the best insurance policy are teeth that lined up properly. So let's get you started.
Awesome. Thank you, Yaya.